Good evening. Welcome to Howard Live. Tonight I'm very happy to have with me Michael Lyon of the San Francisco Gray Panthers. He's a retired biomedical technician at SF General Hospital, which is part of the San Francisco County's Public Health Department. He is also a former physiology teacher at San Francisco City College and a research technician at UCSF. I also have with me Don Bechler, chair of the California Universal Healthcare Organizing Project, who has been campaigning for healthcare minus the healthcare insurance companies for the last 15 years. Welcome to you both.
Thank you. Thanks.
I understand there is a large rally planned for healthcare, for universal healthcare on June 19th. Would you like to tell us about it?
Yes. On Thursday, June 19th in San Francisco at Moscone Convention Center, about 30 groups now have pledged to bring over 1,500 people, that number is growing as we speak, to protest a convention of the health insurance industry of America. The central demand will be healthcare, yes, insurance companies, no. We support H.R. 676, the national legislation for universal health care minus the insurance companies, and Senate Bill 840, the California state legislation for universal health care minus the insurance companies.
And Michael, how do the San Francisco Gray Panthers play a role in this?
We have big bones to pick with the insurance industry, not only in terms of their cheating people who have health insurance in the sense of making them pay outrageous premiums, co-pays, and deductibles, and not skimping on their health care, letting them die in many cases. But we also have a big grudge against the insurance companies because they have actually stolen health care that exists, public health care that exists now. Specifically, the Medicaid aspects of the Medicaid program for the poor, and Medicare for seniors and disabled, and so we have a double grudge against them.
Don mentioned that you've been working on this for the last 15 years, so why don't you start back and give us a little history of the fight that's been going on?
The United States is the only industrialized nation in the world to not have a healthcare system for all its people. And so people for many years have been fighting for that. In 1965, we had the introduction of Medicare and Medicaid. We haven't reached we have not won yet a national healthcare system. So it's part of a long ongoing struggle far before I started working on it. I got interested in it at that time because I was working in a large industrial plant where there were 2,500 layoffs, and people were very fearful of losing their health care coverage, rightfully so. And at that time in California in 1994, there was an initiative on the ballot called Proposition 186 that was for this, for universal health care minus the insurance companies. And I got involved in it and have gotten involved in it ever since. We did not win that, and we're back to trying to win it again. The major problem in America, the major drawback why we don't have a healthcare system, is the existence of the insurance companies. We're not trying to reform them. We're not trying to police them. We're trying to get them out of healthcare because they bring nothing to the table.
And exactly how would this work without the health insurance companies? How do you perceive the system maintaining its integrity?
Just as the Medicare system runs Medicare at this time, we would have, on a national level, the federal government run this. Everybody would get a health care card. It would be progressive taxation instead of health care premiums. You could go to any doctor or hospital you wanted to go to. You no longer would have to go through the rigmarole of trying to work through an insurance company, which their existence causes 31 cents of every healthcare dollar to be wasted and squandered on bureaucracy.
So what it means is that the healthcare would be delivered by today's doctors and clinics and hospitals. That wouldn't change. But the money to pay for these services would go through a single funnel, a state-operated or nationally operated publicly accountable agency, which would collect various monies for health care and also disperse them to providers.
Michael, you mentioned in your bio that you've been fighting issues of racism such as poverty, pollution, and anti-immigrant xenophobia as related to the health care issue. Would you like to explain that a little more?
Well, perhaps many of you saw a recent series of programs called Unnatural Causes Is Inequality Making Us Sick? But it was a painstakingly documented and heart-wrenching account of how differences in wealth and therefore concomitant differences in race cause sickness and early death among us. And it just goes to all possible levels. It has to do with our living, poorer people and racial minorities living in more dangerous situations, more dangerous neighborhoods, worse food, more dangerous work, having less health care. When the health care is available, they tend to be diagnosed less aggressively, treated less aggressively, and so for us, the question of equal health care for everyone is a huge, huge issue, and only single payer can give us that.
Well, Don, why don't we go back for a moment to the rally? Tell us what's happening at Moscone that day exactly, and how you plan to respond.
It's a 3-day convention of the America's Health Insurance Plans, with 38,000 insurance people who try to insure the healthy, avoid the sick, deny claims, and pass costs on to others. So we think that they deserve a rousing unwelcome from San Franciscans and Californians. On Thursday in the morning on a panel, we picked Thursday, it's a 3-day convention, because on Thursday on a panel you have Tommy Thompson, who was from the 2001 to 2004 administration, the head of Health and Human Services, who cut back on health care. Plus you have ex-senators John Breaux and Bill Frist, who have tried to cut back on Medicare and Social Security. And in the afternoon you have speaking George Bush's current personal counselor and Terry McAuliffe, who's the past president of the Democratic National Committee and currently Clinton's campaign manager, speaking, trying to figure out how to work with the insurance companies, and we think that's wrong. So we've picked that day. So at 12 noon for an hour, we'll have a rally with numerous speakers. I could go into that. And it'll be followed by a memorial with caskets and flowers for those people who have died because of the insurance companies trying to avoid sick people who need health care.
Michael, I know you're speaking for the San Francisco Gray Panthers, but there's a national convention for the Gray Panthers coming up. Is healthcare on the agenda?
Is healthcare on the agenda? Yes, the convention is going to be held in Detroit, and we believe somebody from Conyers' office, Representative Conyers' office, who is the author of H.R. 676, the National Single Payer Health Plan. We believe he's going to be speaking to the Gray Panther Convention. Various chapters who are going to be meeting from all over the country are going to be talking about the various kinds of work that they're doing for single-payer healthcare, and of course we're going to be talking about June 19th. So we expect this to be a workshop on how to advance our healthcare agenda, and our agenda is equal, low-cost, comprehensive health care for all.
Don, can you give us a range of the groups that are participating? I think you said there were 15 organizations that have
There's
signed.
more like 30.
Oh.
For the full list, and it's growing. For the full list, you can go to the website. I think it's on your screen, singlepayernow.net. Who's coming and list what groups are coming and how many people they're bringing. The biggest group that will be there is the California School Employees Association. They're bringing 450 people from around California, their whole executive board. Then the California Alliance of Retired Americans is bringing 200 people. Our group, the California Universal Healthcare Organizing Project, is bringing 200. The nurses, California Nurses Association is bringing between 150 and 200. A number of Green Party people are bringing people. I think their list is up to around 90, the different groupings of them. Some candidates are bringing people. Then there's smaller groups that we're still working on. Some unions are coming, others with smaller amounts of people.
Why are the school employees bringing so many?
Because when I say the California School Employees Association, I'm talking about not the teachers and not the administrators. I'm talking about the people who are the janitors, the secretaries, the bus drivers. They're amongst the lower paid school employees. And healthcare is just a huge chunk of their negotiations and a huge chunk of their benefits. And they're being, they're desperately have to fight hard for this to maintain these type of benefits. So they have the biggest field operation in the state, and they're bringing their people. They're mobilizing.
Among our state politicians, who are leading the fight? And let's contrast that a little bit with, say, the governor's plan for health care.
State Senator Sheila Kuehl is the author of Senate Bill 840, the California Universal Health Care Act. She'll be chairing the rally that day. Her bill has 46 co-sponsors in Sacramento. That's out of a total of 120 politicians in California who do their work in Sacramento. So it has huge support. Her support would ensure everybody with top-of-the-line health care. It would be progressively financed. Everybody could go to whatever choice of physician or doctor, nurse practitioner they wanted to go to. And it would save the California this year $17 billion in revenues. And what happens to be the shortfall in the California state budget this year? $16.5 billion? Duh. This could solve all these problems. So it saves money because we get all the bureaucracy out of the healthcare system and just make it a straight system. You're in it and you're covered.
And can you give us an idea of who among our local representatives in the state government are supporting the bill?
They all do. Both assembly members from San Francisco, Fiona Ma and Mark Leno do, and both state senators do, Leland Yee and Carol Migden. Oh, let me throw this in. There's a race going on for state senate right now. Migden, Leno, and Nation. Migden and Leno support Senate Bill 840. Nation does not. He was the only candidate who voted with the Republicans against Senate Bill 840.
Okay.
And how does that contrast with the national situation?
Okay. Nationally, H.R. 676 has 90 co-sponsors in Congress. The bill is by Congressman John Conyers Jr. from Detroit, Michigan. In California, the amount of support here we have is tremendous. In Congress, that would translate into like 261 Congress members and 61 U.S. senators supporting this. So if it was in Congress, this would pass.
Michael, would you like to give us a contrast between the governor's plan for health care and this plan for universal health care under the Senate Bill 840?
Yes, I would, because it's pertinent to what we're going to be talking about at the demonstration. The governor's plan was to what was called an individual mandate. Every person is required to buy health insurance. A minimal amount of money would be paid to very poor people to help them pay those premiums. The health insurance that those people would be likely to get would be extremely stripped down plans, which basically you would go bankrupt before the insurance would ever kick in, because the deductibles would be so high, the co-pays would be so high. So it's basically worthless insurance that people would be required to get. In addition, the amount of money that businesses would have to be able to kick in order to finance this would be less money, that, for instance, than Walmart pays for its health plans. So it's an altogether terrible plan, both from the standpoint of the kind of insurance, the kind of health care that people would get. It would be very unequal. Poor people would get poor care. It's terrible in terms of the expense that people would have to pay, and it's terrible in a sense of unfairness, because rich corporations would pay basically nothing. Essentially, this is what the Democrats are proposing as their health plan, and this is what the convention is in the conference rooms of the convention. This is what they're going to be working out. And so we do not want to see this kind of disaster forced down the throats of 46 million uninsured, and that's part of the reason we're going to be there.
Don, I know that you advocate getting rid of insurance companies, but I'm sure a lot of listeners have been hearing the advertising on the television from the insurance companies saying, we want to be part of the solution. Can you tell us why that's a bad idea?
Yes, they bring nothing to the table. They waste your money. It's like asking the insurance companies to be part of the solution is like asking organized crime to be part of the anti-crime campaign in San Francisco or something. Their whole motive is to make money. Their motive isn't to, have you ever seen an ad on TV that says, do you have cancer of the colon? Come see us. We have insurance for $150 a month. No, they try to avoid sick. Their ads are aimed at young people and people who are birthing age, because those people are healthy. Their whole motivation for what they're doing is wrong. Our motivation is to actually try to insure people. And let me make a comment about Arnold Schwarzenegger and his plan. Arnold Schwarzenegger right now is cutting back on health care in this state. Some people say, oh, he was for health care last year. It's not true. There was a giant movement out there that forced him to react. Not to react meant he would have got rolled over. So in my opinion, he was actually trying to head off the broader movement out there and come up with a solution that retarded it. Well, I went to Sacramento and testified, and his program, what it did was, it insured insurance company profits at 15%. It capped business costs at very low amounts, like 4%, which wouldn't pay for 1/3 of a premium. It did not define what Californians would receive in benefits, and it did not define what the cost would be to Californians. So that's upside down. If you have a proposal for the people of California, you would define what the benefits are, and you would define what the costs are, and let the variables be the insurance companies and the business. But this was upside down and going the other direction. And that's one of the major reasons it lost.
The two Democratic contenders at this point, assuming that you actually consider Hillary still in the race, would like to make a distinction between the health care plans that they're proposing. Would either of you like to comment on that, whether there's actually a difference? And if there is a difference, what is it?
Yes, okay. Hillary is for individual mandate. So he's saying, she has a yo-yo plan. You're on your own. It's the law, you have to buy insurance. Then she vaguely says, well, maybe there'll be some subsidies out there. But her plan is a bigger market share for the insurance companies. Obama, realizing that maybe this isn't the best way to go, doesn't call for individual mandates, but his plan still including in the insurance companies in this situation. So in that sense, we really don't support either one of their plans. And if they were in Sacramento up there along with Arnold's plan, they would have been defeated because they're so vague. What you're really voting for this year, if you're voting for Hillary or Obama, is you're kind of voting for who would you rather negotiate with once they're in office. I mean, I expect Obama to win at this point, like everybody else thinks. That's what you would be voting for if you're voting for one of them. But then we have to be clear, once they're in, what are we negotiating for with them? And that's H.R. House Resolution 676, the United States National Health Insurance Act by John Conyers.
Do either of you know whether John McCain has a position on health care, clear position at this point?
Yes. Go ahead. Or I'll go. Whatever you want.
Go ahead.
He says, let the market magic work. And the magic, which is just a fallacy. He's entitled to his opinions, but he's not entitled to his facts. And facts are the market has never worked in this country for health insurance. It's been around, selling private insurance has been around since the early 1900s. And what do we have today? 47 million people uninsured. We spend 2 or 4 times as much as any other nation on earth. We have 18,000 deaths a year because there's no insurance for everybody. We have 3 million people a year go bankrupt, and over half of those are bankruptcies because of medical bills. And 3/4 of those people who go bankrupt because of medical bills had insurance. The insurance you have can be worthless once you really have to use it. So he wants to open up the market. He also wants to stop states from regulating insurance companies within their states. So for instance, in California, we have a set of laws called the Knox-Keene laws, which protect somewhat what insurance companies have to provide. So if you have a mastectomy, then you also have those laws say that the insurance company also has to pay for reconstructive breast surgery on you, okay? So that's a California law. He would do away with that. He would let churches in North Dakota or Florida sell health policies that had severe limitations on how many days they'd pay for a hospital visit. He would just gut whatever attempts at laws to govern the insurance companies we have now.
Okay. Well,
and he's not, and I mean, he's not. The Republicans don't have a monopoly on this free market approach. I mean, there have been Democrats who also push similar bills.
Okay. Before we run out of time, Michael, let's start with you. Gray Panthers have an ongoing discussion about health care. Why don't you give us the dates of your monthly meetings when people can come by to learn more about what you're doing?
Our health committee meets on the second Tuesday of every month at 1 o'clock at our office, and the address of the office is 1182 Market Street, which is on the corner of Market, Hyde, and 8th. It's right next door to the Orpheum Theater, and it's room 203. Our general meetings are on the third Tuesday of every month, but this month our general meeting is going to be on June 19th at the convention.
Okay, well then that's a good point to ask you, Don. If people want to participate in this, aside from going to your website, how would they get involved, and particularly for groups who are interested, how would they contact you?
All the information is on the website to contact us via email, and our phone is there. It's our website that we're using as the website for all the groups who are in this demonstration. So it's singleparenow.net, or they can call in San Francisco 695-7891, 7891.
Great. Well, I really appreciate both of you being here today. Healthcare is a powerful issue that's going to play, I think, an important role in the presidential campaign this year, and it should be playing a role in virtually every campaign for state office and federal office as well. I hope that all of you will take the time to visit the website, learn more about what these groups are doing, and take time to participate in some manner. Whether you can attend the June 19th convention rally or not, it's time for all of us to be involved in this very important issue. Thank you, and good night.